Good morning. My name is Dez Wilson. I'm a producer with Reckon, and I have a very special guest today on our segment Black with COVID. Have Doctors Anthony and Marlo Paul of Abundant Life Wellness Center and Eden Life Farms in Sawyerville and Gainesville in Sumter County. Doctors Paul, thank you for taking the time out to speak with me today. If you could just give me a little bit of background, and just so you guys know, to the viewers that are watching, Doctors Anthony and Marlo Paul are board certified doctors in internal medicine and biology, and for the last 15 to 20 years have practiced and studied natural medicine and the intersection of natural medicine and biology, and currently are treating patients in the Black Belt in Southern Alabama through natural medicine. They grow their own herbs on their farm and are really revolutionizing, the work between treatment and prevention of these issues. And so I wanted to bring you guys on again. Thank you for taking the time and come out. If you could just tell me what led you guys to medicine, and how did you begin this transition from kind of traditional modern medicine teaching into natural medicine now?
Yeah. Well, I have been teaching for the last 30 years in biology. I was chairman of the biology department at Oak University for about 25 years, training doctors, preparing pre-med students for dentistry and medicine. And so my line of thought was always along conventional medicine, getting kids into the Harvard Mayo Clinic and so forth. And also we have a nonprofit organization called NAPS, the National Association for the Prevention of Starvation. We travel the world, especially throughout Africa, the Caribbean, South America, doing medical work and different interventions. And for the last 15 years, I've been having conversations with folks who use the natural remedies and so forth, just to explore. And by so doing, I was convinced that there was something there. And so I started to study these herbs from a scientific point of view, and realized that efficacy was matching that even better than conventional medicine. And so I introduced it to my dear wife, the physician, and she will tell you, take the story from there.
Hello, everyone. Yes, so I'm an internal medicine physician. I received my medical degree at Loma Linda University in California, and then completed my residency program in Tennessee, University of Tennessee Medical Center. So yes, I was trained in conventional medicine. And so when my dear husband came to me with these plants, I just kind of pushed it to the side because I needed some research, some evidence to show that it was actually true. And so after a while, after much convincing, he got me to start to take some, and I noticed I had more energy. I was playing tennis longer, not getting tired. So I said, well, I'm going to look and see if there's any evidence-based research. And so what we started doing is putting our heads together, and I would say, okay, here's lisinopril for blood pressure. And he would look and say, hey, this comes from this plant derivative. Let's get the seeds, let's grow it. So what a lot of you may not realize is that a lot of our pharmaceutical medications actually were derived from plants. But the pharmaceutical companies cannot patent a plant. So they have to take an analog of that plant and produce it. And unfortunately, analogs lead to side effects. Whereas the plant, if you were to take the plant as a whole entity, you wouldn't experience these side effects. So now the transition came to sharing it with the patients. Right. And that was a little hard for me.
Let's start with family members first.
We did, yeah.
So we started using among the family members, and I think at one time in 2008, I think it was, we were going to Madagascar, and we had all our missionaries to take the DP3 before we left for that journey. And we realized that no one got sick during that mission. And usually it's diarrhea, there's a lot of problems, you have allergies, what have you. So I think that was the bridge for my dear wife to allow her to cross over into this whole new realm of treatment.
Mhm.
And then we start treating our friends, family members, and then the word got out to some of our patients.
Right. And so when we moved down here to the Black Belt area, that's when I really started seeing the importance of it, because we were doing a lot of prevention down here. So a lot of teaching on lifestyle changes, the importance of healthy living, healthy eating. And a lot of the patients don't have insurance. They cannot afford their medications.
Mm.
So the thought was, okay, my husband, he's going to change this place where we live into an herbal farm, grow the plants, we process them here. And then for the patients that are interested, or maybe they cannot afford medication, we would offer it to them. And again, being trained as a conventional doctor, it was kind of difficult for me to step over into that realm. Part of it was pride, I will admit. I don't want people thinking I'm some quack doctor and with no foundation research. And so, but you have to follow God's calling on your life. You have to be obedient. And so when I started sharing the plants that my husband would prepare with the patients, I myself was very amazed to see that I was able to taper them off of their insulin or taper them down off their blood pressure medication because their numbers started dropping precipitously. I was very elated to hear, Dr. Paul, I have so much more energy. My vision has gotten better. My asthma is not acting up anymore. My joint pain is better. And I think that's when I really came to the realization that we are created by God. Nature is created by God. So he has given us medicine in his creation, but we've overlooked it. We've bypassed it. And we've gotten so caught up with money and how to make money at the expense of somebody's health that we've kind of gone the wrong direction. So.
And Dr. Anthony shared with me earlier that, the transition you guys have had to make from conventional medicine into practicing natural medicine has not been an easy one. And, Dr. Anthony, you're chairman of biology at Oakwood. What does that, how does that kind of dichotomy, work for you? How do you work within those kind of opposing, fields?
It's a challenge because I remember one person we were treating. I'm going to call it the disease, but it was a serious one, and he got healed. He did well, so he went up to New York City to get a scan to make sure that everything was okay. And so they took him to the scan, and when he was through with the scanning, the technicians or the doctor told him that the radiologist told him that we have good news for you. You're free of cancer. You're free of illness. And so he got up and he started publishing that what the doctors that we couldn't do for him in 6 weeks, this machine did for him in 5 minutes. He attributed the healing to the machine. So that is a challenge that we have, is that a simple herbal treatment, how can you match up with a blue pill or red pill that is well packaged and what have you. And the instant effect that you get from the pharmaceutical is a challenge too, because you don't see the after effects of it.
And I would like to clarify that when we do work with patients, we do not take them off their prescription medications.
Gotcha.
We work with them. We tell them to stay on everything. And when we start seeing improvement and see no need for it, then safely we'll wean you down off of it. So by no means is anybody watching just to throw all their medication away. It needs to be done under the supervision of a physician who's also maybe interested in helping you with lifestyle and natural remedies.
Absolutely. And you guys have DP3 herbs as the medium that you provide your herbal supplements through. Could you share with us what some of those herbs are and what are some of the properties that you found that they help treat?
Right. So there's a lot of work being done now around the world and the United States. They're combing through plants. The pharmaceutical have an interest in it. The other homeopaths have interest in it too. But they're combing through these plants looking for medicinal compounds. And so what we do, we go behind them. Whatever they have found, we go find a plant that they derive from. And we'll take those plants and grow them. And so we have about 30 different plants that we grow for different things. And so one of the major plants, the two basic plants that we have that's a foundation of our DP3 is the Moringa oleifera, and the Sadrifa, the sorrel plant. Those two plants have a diverse amount of compounds in it that addresses a lot of things in physiology. Basically what they do to clean up your cells and allow your cells to breathe again. So that's why it is so broad in its application in cure. Well, maintaining good health. You don't have to use the word cure. But if it strengthens all the cells in your body and clean up your receptor sites, then your eyes will work better, your memory will work better, your lungs work better. And that's what we're seeing. As my wife was saying, she treats someone for diabetes and they say, my migraine is now gone. And so we add that to the list. So we grow those plants here, and then we harvest them, freeze dry them, and then we pulverize them and capsulate them, put them in capsules, and vegetable capsules. All is organic. And that's where we distribute our products right here in Gainesville. So we have a basic DP3 that addresses, maintenance of good health and so forth. And then if we have hypertension, we add the hypertensive herbs to the basic, and we label that as hypertensive.
Gotcha.
So
go ahead.
No, I would say, just to give you an example. So for instance, one of the plants is periwinkle. The scientific name is Coranthus roseus, and you guys have probably seen it. It's a beautiful flower plant. Before, in the past days, the genus name was Vinca. And the reason why it was Vinca is because of the ingredient it had called Vinca alkaloid. Some of you out there may be familiar with the chemotherapy drugs, vincristine, vinblastin, used to treat many different types of cancer, still being used. If you research those drugs, you'll see that they actually derive those drugs from the periwinkle plant. And that's why the similarity in names, the Vinca alkaloid, vincristine, vinblastin. So that's just one of many, many examples of how our pharmaceutical drugs have been derived from plants.
I wanted to ask, COVID-19 has been disproportionately affecting the Black community, specifically the African-American community. One of the things I was asking Dr. Anthony about have we seen those same numbers reflected in Africa? Is this is this really focused on race, or is this more focused on lifestyle, access to healthcare, comorbidities? Could you guys, kind of speak on that?
Yes, we have branches, we have connections, stations in Southern Africa, in Madagascar, in the Caribbean, and even deep into the Amazon. There are problems with COVID-19, but not as intense. So we have concluded, while we're still working with them there, and they treat we don't send the DP3 to them. We inform them what they can use to fight the COVID-19. We haven't lost anyone there. We have not heard anyone die from it yet. But what we realize is not genetic. It's not a genetic thing. It's a function of education and lifestyle, and implementing the things that we know. We have been living. We are caught in this darkness. We don't exercise anymore like we used to. We eat. We don't eat intelligently. We hold on to those things we call cultural food, and obesity is rampant throughout. When you superimpose, Mr. Wilson, when you superimpose cancer, high blood pressure, diabetes, on obesity, on the southern region, it falls straight along the Black Belt where the Black population is. There's one other place that it also falls. It's West Virginia. I don't think there's any Black folks in West Virginia, but the lifestyle of the people in West Virginia and poverty is similar to that of the Black Belt. So that concludes that it's not a racial thing, not genetic. It is it's our lifestyle. And we have a challenge right now after this COVID, even right now, we're trying to get into the schools. We have to get to the younger ones. Because right now we're treating the older folks and it's kind of hard, but we have a lot of success, but we want to get into the schools to get those young ones started up.
I wanted to ask that, a lot of people are, essentially, there is no current vaccine or, guaranteed treatment or prevention for COVID-19. And people like myself who did contract the virus, all the official documents we're provided with just say drink water and go home and quarantine. And that's leaving a lot of people lost and essentially, very, scared in a lot of cases. They don't know what to do and they want some more guidance and advice. Do you have any advice for people who are currently battling COVID-19, or even if they're not battling, what can we do to help prevent the spread and from contracting it, especially in the Black and Brown communities that are being disproportionately affected?
Yes, most definitely. And we can later give you a sheet that maybe can be posted somewhere where people can go back and look at it. But with these guidelines that we're about to share with you, it has helped, along with the DP3, in a very quick recovery with those who have COVID-19. And then for those who are trying to avoid getting it, especially our colleagues who work in hospitals, ICUs, and are battling this, every day. So number one would be, and this is probably the hardest one, avoid sugar. And the reason is sugar compromises the immune system. And when we say sugar, we're not talking about fruits. Natural sugars are fine, but a lot of your refined processed sugars will compromise your immune system. Are we still there?
Yes, we're still here. Mm-hmm.
Okay, so what happens with sugars is they hinder your body's ability, your white blood cells' ability to function at full capacity. And we can just give you a quick example. We talk about the flu season, which is from October to March. And a lot of people say, my auntie gave me the flu. Well, your auntie didn't give you the flu. You caught the flu. And that's because your immune system was compromised. And so what happens is when your immune system, when in October, we have some people celebrate Halloween, they have the sugar from the candy. Thanksgiving, you have the pies, the cakes. Christmas, same thing, pies, cakes. You're up late with your family. New Year's, same thing. And then February, Valentine's Day, same thing. Well, there's your flu season, right? And so I'm a living witness. In 20 years, I've never had to be on antibiotics. I've never caught the flu, yet I'm still during those times looking in people's mouth while they're coughing and sneezing. And I have yet to come down with it, but that's only because I make sure my immune system is at its best by avoiding sugar and mainly just eating lots of fruits. So that's number one. Number two is your rest is very important. Every hour before midnight is worth 2 hours. And so we try to tell people not to go to bed later than 10. That's when your body replenishes, restores the hormones and different things that it needs to fight the next day. And so you want to be able to operate on a full tank. The other thing is check your vitamin D levels. Make sure your vitamin D levels are within normal range. A recent article came out that showed individuals with low vitamin D who caught COVID had a 98% mortality rate, while those with normal vitamin D, their mortality rate dropped to 4%. And as people with color and being locked up in our homes, it's easy for us to acquire low vitamin D. To have low vitamin D because you get it from the sun. And with the darker pigment of our skin, we need sun exposure much longer than, per se, a Caucasian person. We would need sun at least 30 minutes every day. And even though you can feel it while you're in your car, you do not get the benefits of it if there's window or glass between you and the sun. So if you haven't had your vitamin D levels checked, or you just want to take it, you can just take like 2,000 international units a day. That really helps. Exercise is extremely important to help with circulation, getting deep breaths of clean oxygen and air outside. And even our patients who have COVID, we tell them, go outside in the morning, take off your mask when you're by yourself, and just take deep breaths. We see a lot of people wearing masks when they don't need to, and that compromises your lungs' ability to work properly. The other thing is called a hydrothermal therapy, which also helps to optimize your immune system. And what you do is you take your shower. For people with COVID-19, we suggest they do this twice a day. But for those who are just trying to prevent it, we do it once a day. You take your shower, 10 minutes, get the water as hot as you can take it, do the usual things you would normally do. But right before getting out of the shower, for 15 to 30 seconds, turn the water to cold and let the cold water hit your body. And that really helps optimize the immune system, causes the blood to flush the organs, and you'll feel energized too. You'll really feel energized. So those are the main things that we encourage people to do for prevention. And I don't think that I missed anything.
No, I think that stress that masking at the way the house, when you walk in the street, you do not in close contact.
Yeah, we've seen a lot of people wearing their mask while driving, you know, and even with no one else in the car with them.
Right.
And so, you know, want to reiterate that, you know, the doctors are saying that, you know, it's important to get fresh air. It's important to get sunlight, especially in Black and brown communities where we have higher percentages of melanin content in our skin. It's important that we get direct sunlight. Again, indirect sunlight does not have the same benefits. You need direct sunlight. We need to be outside. You need to breathe fresh air. So just want to reiterate some of the things that the doctors were mentioning. Wanted to ask, I have a comment here from Martez Files. He asked about brain fog and depression as a lingering side effect of COVID-19. Are there any plant-based recommendations to address it? And before you answer that, I wanted to ask, you know, how have you guys, do you guys or have you been treating mental illness? How have your herbal supplements and research found that, you know, the DP3 supplements can, you know, and this plant-based research, in addition to it having positive benefits in some areas that you weren't expecting, have you seen benefits in terms of mental health, anxiety and depression, et cetera?
Yes, we have. And all of this is, just so you guys know, all of these things, the DP3 is very much pre-COVID. Okay, COVID came and it was just incidental finding that all of our patients who were on DP3 for other issues did not come down with COVID despite being exposed. So that's just to make that clarification. But prior to, yes, we have treated people with dementia, Alzheimer's dementia, anxiety, depression, ADHD, autism. And so my husband can speak more of the different plants and why they're effective.
So interestingly about plants that is really intriguing to me is that if someone has a brain tumor, I think there's no alternative but radiation, because there are no chemotherapy drugs that can cross the blood-brain barrier. The body has been so created that the brain is protected from any kind of miscellaneous compounds in the blood. So there's that barrier that's very restrictive. However, we found in several of our plants, just from research, that there are compounds that can cross the blood-brain barrier. And so we have collected those plants to be treating people with early stage dementia, not late stage. We have not any success with late stage, but early stage. And we have one little anecdotal story about this woman. She was treating her husband with the DP3, and she asked could we cut back on it because he was remembering too much stuff.
Wow.
she was not happy with the things he was remembering. But so there's so many things in that plan. And again, the reason why it's not as popular is that, as I mentioned, when you heal a patient, you lose a customer. And so there's no incentive to really promote the natural healing. So it's out there, but I'm amazed. I wish I could go back and start all over again with my student. I would most likely have a class in herbal medicine. I think every university should have one. But I guess they would not be supported because the pharmaceuticals will dominate. Even with us now, we are counting our days.
Wow. Well, again, I want to thank you guys for taking the time to speak with us. Again, I'm definitely going to have you guys on in the future to speak on this information. Again, it's important that we understand the importance of boosting our immune systems, especially now. I think for our generation, it's more important than we've ever experienced. Dealing with this pandemic and knowing that it's disproportionately affecting the Black community, Black and Hispanic communities, we need to know what we have to do specifically to prevent and fight this virus. Given that there is not a formal vaccine being provided yet, want to ask, is there anything else you want to tell our viewers that they need to know or should be doing in terms of general lifestyle practices based off the research and experience that you guys have?
I just like to repeat what you just said there. There's no cure in sight. There's no treatment, and that what we have to do is to create our defense. And defense is to build the immune system. And there are many things out there you can do, but practically what the doctor just mentioned there, fresh air, exercise, watch your diet, lots of green leafy vegetable diet, fruits, nuts and grains. Think clearly, that is, don't be stressed out because stress also will compromise your immune system. And be happy.
Yes.
I want to make sure. I want to make sure we say that clearly. That the doctors are saying your mental state can greatly affect how your body is reacting and fighting off any virus. I think obviously this goes past COVID-19, but stress and your mental health, and obviously quarantine and our lack of social interactions right now, the abrupt shift in society and reality has really shaken and affected a lot of people, even subconsciously. A lot of people don't know that they're battling depression right now, and they're battling social withdrawals. And so it's important that
let me say something on depression that we have found. We have a lot of people who deal with depression, even in our organization. And what we have found is that people who have depression, we realize that one of the best remedy for it is service in service. Whenever they are serving, be in mission field, home or abroad, there's no signs of depression.
And what type of service do you mean?
Service, helping others, finding someone of like manner, no matter what it is, but just helping another fellow human gives you some sort of revival. It stimulates some sort of hormones in your body.
Wow.
And they all testified that's the happiest moment in their life is when they're out serving.
Wow. Well, that's important. Hey, y'all, look, if you're feeling some kind of way, get out the house and go help somebody. Go cut your neighbor's lawn or something. Clean out that closet and go donate some of those clothes. So again, I don't want to keep you guys too long. I know you got a lot of patients to treat. I wanted to ask, how has the pandemic affected your practice? I think, Dr. Marlo, you were doing a telemedicine call earlier. Are you seeing more? Are you doing more virtual consultations?
Right. Yes. So we're doing telehealth. Mainly, we make an exception for people that it's kind of hard to diagnose and treat over the phone, but we limit the number of patients in our clinic to just one at a time. Make sure that they have their mask on, they get Purell hand sanitizer right when they come in, and then we sanitize everything, the vital sign equipment, the room, doorknobs after they leave. We just really try to take precautionary measures. And most of our time actually is with my husband and our medical team, volunteer team, where we go home to home treating COVID patients and families. So.
And again, you guys provide the services at your wellness center. These are free services?
Correct. So with our clinics, on our outpatient clinics, we do accept insurance, but we don't turn anyone away if they don't have insurance. And then for the DP3 supplement, that is part of our ministry. So in the Black Belt area, that is free of charge, but the person receiving has to work with us on lifestyle changes. If they're not willing to work on those changes, then they can buy it if they want. But if they really are interested in making lifestyle changes and working with us, then they get it for free.
Wow. Oh, look, the work you guys are doing is amazing, especially in the Black Belt. We know that access to healthcare, access to healthy foods, general lifestyle practices, diabetes, obesity, these are things that are plaguing the Black community within the Black Belt in the South, and have a very high contribution to how COVID-19 is affecting us. So again, these are Doctors Anthony and Marlo Paul of DP3 Herbs and Edenland Farms. They are located in Southern Alabama. If you'd like more information on them, you can visit dp3herbs.org. I'll go ahead and place that up here now. But again, want to thank you guys for taking this time out. And I'm definitely going to have this conversation again, follow up with you, possibly have some other Black and brown folks who are battling COVID-19 so they can get some direct advice and ask a couple of questions. Thank you guys for your time and for the work that you're doing. It's very important.
Thank you for the opportunity.
Thank you. All right. And this is it, guys. Thank you again for tuning in. Again, Doctors Anthony and Marlo Paul of DP3 Herbs. Visit their website, do your research, learn more about the herbal supplement that they're providing. Again, they are PhD board certified physicians in internal medicine and plant science. And the work they're doing in the Black Belt is unmatched. It's extremely important that we acknowledge the work that they're doing and understand the research and the proven benefits behind natural medicine that they've spent, close to 20 years in researching and developing. So again, thank you guys for tuning in. Black with COVID. We'll do this again next Monday at 11 a.m. If you have any questions that you'd like me to ask on the next segment, please feel free to contact me directly. You can email me at dwilson@al.com. Again, thank you and tune in next week.